So having reliable data is really important for us to understand what services we may need to plan for in the future. And part of that is who we are, how many of us there are, how long we live. But also it's important that we capture the preventative aspect and look at what's affecting the health in our lives and look at planning services to help us live longer, live healthier, because why shouldn't Gibraltar be one of the healthiest places on the planet to live? And hence why we're pulling together lots of data from lots of different departments to take a holistic view in terms of what's affecting our lives.
And what are some of the health issues you're anticipating will be tackled? Perhaps things like diet, air pollution. What are some of the areas that you anticipate might come up?
So absolutely, it's a great question in terms of what do we expect the outputs and outcomes to be from the Joint Strategic Needs Assessment. There's going to be a range of things we're going to look at because the pandemic has taught us that people have had worse outcomes if they were, for example, suffered from obesity, if they were smokers. And those are things that we can support people with to address and tackle. So they are exactly the sort of things that we're going to look at. We also look at wider issues in terms of what impacts how healthy people's lives are. That being, for example, the environment, the air we breathe, the housing we live in, the jobs we do. So it's a whole range of factors that we'll be looking at. And the purpose of this is to then inform a public health prevention strategy for Gibraltar that's going to set our sort of roadmap for what we're going to do over the forthcoming years.
And what will be discussed at this inaugural meeting? What's the first step in the process?
So the first step today at the inaugural meeting is pulling people together from across government. When I arrived here, I was told we don't have much data. Actually, we have a lot of data, but it's in a lot of different departments at the moment, and a lot of different systems analysed, looked at slightly differently. So the purpose of this is to bring us together across government, so it's not just health data, it's wider data, to look at what data we've got, what gaps we've got, and then in the future what we'd like to do is evolve this to capture what we call an asset-based approach. Now, assets are community strengths, and gosh, Gibraltar has got a lot of community strengths in terms of our charities, the strength of our community, the connectiveness. So we're going to evolve this process so it's not just about the numbers in the future, but we also capture our community strengths.
You say the pandemic has highlighted the importance of health. In terms of the pandemic itself, where is Gibraltar at the moment? We've seen a drop in cases to just under 400 active cases, but there are 9 people in hospital. What is the COVID situation in Gibraltar at the moment?
The COVID situation in Gibraltar is looking a lot more positive than we were a month ago. The number of cases that we're experiencing has come down dramatically, which is incredibly good news. Most of the people who are hospitalised, it is with COVID rather than from COVID. So it's not as a result of them having COVID. These are people who are swabbed on admission, but we have to cohort them, and that's why they're in the numbers. So we are expecting an announcement in the next couple of days highlighting what our exit strategy is going to be. That will be bespoke for Gibraltar and tailored to our needs and circumstances.